The rise in coronavirus cases has parents concerned for the upcoming school year. The largest school district in the state, Jefferson County, has decided to require universal masking. It's a move many districts are choosing not to make, while others haven't made a decision yet. In-depth reporter Christiana Ford looked into why and what's changed with how schools are dealing with COVID-19.
The chairs are empty at Bourbon County Preschool Head Start, but pretty soon that silence will turn into more than 100 little voices.
I stay pretty busy with my kids here.
Nurse Deanna Berry has been in charge of keeping thousands of students in Bourbon County safe during the pandemic as district health coordinator.
COVID takes up a lot of your time. It's one call after another, at least hourly, about, hey, what about this kid? What about this case? What about this staff member?
But this year, Berry's feeling even more confident about handling COVID in their schools and more confident with the decisions they're making to take a little focus off of COVID-19. Decisions like continuing to let families choose whether their kids will wear a mask or not, even as they head back in a COVID surge.
We have no plans to get together and change anything on that. We still have a lot of students and staff that choose to wear a mask, and that's fine.
Having not seen a surge in cases since November 2021, Berry says they started to shift last spring, taking down barriers and plexiglass toward the end of the last school year.
I think they're going to be really excited to be able to continue that this year.
But we're 2 weeks away from the start of the school year, and there are so many districts who haven't made that decision yet. So we came to the Kentucky School Board Association to find out what goes into that process and why it's taking so long.
I think a lot of districts, what we've learned so far from the pandemic is trying to plan a month out, 2 weeks out, even a week in advance can be a challenge when circumstances in a community can change week to week, even day to day.
That's why Director of Communications Josh Schultes says a lot of districts won't finalize plans until just before their start date. But he says parents should expect a shift in focus.
We've been so diligent about COVID over the last few years, and sometimes when you spend so much time and you put so much effort and you ask so much of families during that time, patience can wear thin. And the desire to get back to education as we once knew it is definitely at kind of an all-time high.
Because like Bourbon County schools, there was a point when a light bulb went off for many districts. Pediatric infectious disease expert with Kentucky Children's Hospital, Dr. Sean McTeague, says schools have realized they aren't the super spreaders many feared they would be. And McTeague says over time, data showed children weren't getting as sick from the virus as other populations.
The level of concern parents should have regarding COVID should certainly be much lower now than it was earlier in the pandemic. What we've been seeing is that, especially with regards to children, we see very few hospitalizations now for COVID. At most times, we have 0 children admitted to Kentucky Children's Hospital for COVID-19.
Immunity thanks to vaccinations have also helped. 1% of kids 0 to 4. 24% of kids 5 to 11, 49% of kids 12 to 15, and 53% of kids 16 to 17 have gotten at least one COVID shot, according to the state health department.
Access to vaccines is now 100% as far as school-age children. While we'd like to see it higher, we've certainly seen progress.
Progress Nurse Berry is grateful for. In Bourbon County, Christiana Ford, LEX 18 News.